Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Well, welcome back to another episode of the Dental Implant Practices podcast. I'm your host, Philip Gordon, and today it is my special pleasure to have Dr. Frank Recker on. Frank, why don't you do a little brief introduction of yourself and your role with the AAID?
Great, Phil. I've been general counsel for the AAID since about 1991, so about 25 years. And the AAID prides itself on educating dentists in the field of implant dentistry. So back in the 90s, you couldn't even advertise credentials earned through the AAID. Most states prohibited that. They only allowed what the ADA recognized, and of course the ADA only recognizes specialties, 9 specialties. They don't undertake a study of any organization's credentialing, the integrity or the intensity of the credentialing. So the AAID started about 20 years ago going to court and challenging different states' prohibitions on advertising credentials earned through the AAID. And as you know, they have an associate fellow, and of course the Diplomat from their certifying board, the American Board of Oral Implantology, Implant Dentistry. So after multiple court victories that said these are First Amendment rights to advertise credentials, they're bona fide, they're truthful, it's not misleading, dentists in various states started to do that. And in fact, most states eventually adopted regulations expressly permitting the advertising of AAID credentials. In about 2012, we challenged the state of Texas on a prohibition of advertising credentials, and they agreed to amend the regulation and allow it with a disclaimer of general dentists if that were applicable. A couple years later, the AAID realized that what it really needed to do was to obtain the right to advertise as specialists in implant dentistry if a dentist were board certified by the ABOID, its certifying board, that if you look at the requirements for eligibility of that examination, they're tough. They're very tough. And probably in 25 years, at the present time, there's only about 435 diplomats. So you can see these credentials aren't issued by simply sending in a check. They're tough to earn, they're rigorous, and they challenge the state of Texas along with oral medicine, oral facial pain, dental anesthesia, and implant dentistry, AAID, filed suit in federal court against the state of Texas, stating that it was an unconstitutional violation of the rights under the commercial free speech provisions of the First Amendment to prohibit them from advertising as specialists in the state of Texas. And, of course, the lower court in January of 2016 issued a decision that said we were right, we had the right to do that, and it enjoined the state of Texas from prohibiting these organizations and the respective credentialed members from advertising as specialists in their respective areas in the state of Texas. That case is now on appeal in the Fifth Circuit, and oral arguments were held just this past Tuesday.
That's a lot of information there. I'm going to have you kind of break that down for me. You've been associating with and counseling for the AAID for 25 years, and the AAID has been working at gaining permission for specialists and generalists alike to advertise as implant specialists if they meet the AAID's rigorous criteria. And as of lately, that has passed in a lower circuit in Texas. Is that what I'm gathering?
That's correct.
Like I was telling you earlier, I'm very familiar with a lot of dental terms. I'm not very good with lawyer talk. So kind of dumb it down for me if you could. What does this mean for general dentists placing implants, specialists placing implants right now as it relates to other states, not Texas, of course? What does that mean towards other states in the future? And what's the ADA going to do about other specialties kind of moving forward?
Well, it's a good question, Phil. The 4 organizations, American Academy of Oral Medicine, American Society of Dentist Anesthesiologists, American Academy of Oral Facial Pain, and the AAID, they're certifying boards got together and formed the American Board of Dental Specialties. That is the answer to the ADA specialty recognition process. Anesthesia, in my opinion, basically exposed the ADA process as being a little too, anti-competitive. The House of Delegates is comprised of about 480 dentists, and the ADA process allows them to decide whether or not an area will be recognized as a specialty area of dentistry. And in October of 2012, anesthesia had fulfilled every requirement and had been approved by every council and commission with jurisdiction over the specialty process. But when it got to the House of Delegates, they turned it down. They voted no. So, in my opinion, there'll never be another organization applying for specialty through the ADA. It's too incestuous. You have dentist competitors on the floor deciding whether or not they want a new specialty. And when a state simply accepts ADA specialties, what they're really saying is, we're going to allow the ADA to decide the First Amendment rights of the dentists in our state. And that's been deemed unconstitutional. In response to this, within the past year, the ADA has been, in my opinion, very proactive, and their attorneys recognize the dangers of states simply deferring to them, and they recognize the antitrust implications of their having this sole specialty recognition process. So the ADA was very proactive, and they came up with Resolution 65, which was from the Council on Ethics, Bylaws, and Judicial Affairs. And essentially, that resolution passed a week ago Monday in the House of Delegates. And basically, it amends the Code of Ethics, which says, first of all, specialists are not limited to their specialty areas when they practice. It's not unethical for them to do other areas of dentistry. So if an oral surgeon wants to do crown bridge, the ADA Code of Ethics now allows that. The other amendment to 5H, the 5H section of the Code of Ethics and Principles of the ADA, it also says if a jurisdiction a dentist is licensed in, for example, Ohio, if Ohio decides to recognize the ABDS, American Board of Dental Specialties, and the specialty boards, the certifying boards that they recognize, that the ABDS recognizes as specialists, that's okay with the ADA. They will also then recognize those dentists as specialists. So, for example, if Ohio, who's now undertaking changes to their specialty designation, if they say, we accept, for purposes of advertising, you can advertise as a specialist if you're one of the 9 ADA recognized, or if you're recognized by the ABDS. So the ADA is saying, we don't have a problem with that. If a state says, Dr. X, cosmetic dentistry, whatever, with this credential is a specialist, that's okay with us. It's not in violation of the Code of Ethics. So the ADA has come a long way in a short period of time to recognize the realities of what's going on in the states and in the courts.
I guess that raises a couple questions. It's kind of like the federal courts going to the state courts and saying, make your own rules. Is that kind of correct?
Well,
if the ADA was the federal court, they would push it on to the states and say, you guys determine
correct
who you deem specialist, and we're going to have these major categories, and you guys can decide the subcategories. I mean, is that kind of the gist of it?
Yes, and the ADA is saying we don't have a problem with that.
Okay. Now, you said some very interesting things that I think raise a lot of red flags for patients and dentists alone. You said specialists aren't limited to the scope of practice just in that specialty. Now, that's going to be a big change because in the past, an endodontist couldn't prep a crown, and an oral surgeon couldn't fix the prosthetics on the end of the teeth. And now you're saying that they can. So how is that going to affect the referral relationship that's going on in dentistry right now? If I refer an endodontist a root canal, and they do the root canal build-up and crown, and that patient comes back with their work completed, does that create a conflict of interest? Does that create conflicts between provider relationships? And is that actually hurting the profession more than it's helping?
Phil, that's an excellent question. And if you look at most states have one license. I'm licensed in Ohio. I have the same I'm a general. I don't practice, but I'm a general dentist. If the oral surgeons have the same license I do, I'm allowed to do what they do, but they weren't allowed to do what I do because they could call themselves a specialist in oral surgery. So you look at the First Amendment and antitrust implications of that, and that's one of the reasons the ADA recommended a change. In conversations with the Council on Bylaws, Judicial Affairs, there were comments like, well, why would I want to send my patient to an oral surgeon for X procedure and then lose the patient? Well, that's marketplace. How that affects patients, referrals, that's going to be determined by the marketplace. And obviously an oral surgeon shouldn't be doing crowns if he doesn't have the adequate training or experience to do that. The flip side is it could also help access to care issues. If a specialist, goes in some remote rural area to do X procedures in a specialty, and there aren't general dentists around or aren't dentists around to do what else is needed, if that specialist felt competent, he or she could perform those needed procedures. So that would obviously benefit the public. But keeping somebody from practicing what they're licensed to do, only because they can also advertise as a specialist, has some antitrust implications to it that the ADA recognized and doesn't want to confront down the road.
Sure. And some of these are just kind of devil's advocate questions that I'm asking, not that I'm
sure
contradicting what is right or wrong here. These are just questions that I know will arise and are arise. So assuming that the ADA recognizes it, the American Board of Dental Specialties has to recognize it for each state. Are there people that might be grandfathered into that specialty, say a 55-year-old general dentist who has placed over 10,000 implants but has never gone through the credentialing process, may have a wealth of experience over a 1-year postgraduate periodontist who has only placed 10 implants in his life and isn't nearly the amount of specialty training as the 55-year-old who's placed tens of thousands of implants over his career? Is there going to be a grandfathering in? And also, who decides which groups are the specialty groups? I mean, is it in the implants? It might be the AAID, but what about the ICOI or the cosmetic department? Who decides which group gets to do the credentialing? So I guess those are two different questions.
Well, sure. First of all, it's the grandfathering. And every dentist in the world realizes that because a periodontist is able to place implants, he or she may have done 10 in their career, may not even have placed one in their postgraduate program. So that's an excellent question. Compared to the dentist that's 55 that you're suggesting, that dentist needs to obtain a credential which denotes specialty recognition. Now, the ABDS, American Board of Dental Specialties, recognizes the certifying board of the AAID, that is the American Board of Oral Implantology/Implant Dentistry. They recognize that board as certifying specialist in implant dentistry. So that 55-year-old dentist needs to get online, see the requirements to take the challenging exam, and take it. It's that simple. And there are a number of cases you have to document that you've done over the past X number of years. There are psychometric testing, both written and oral. It's not a gimme. If the ICOI wants to be recognized by the ABDS, they need to apply. ABDS has a rigorous list of requirements that a certifying board must demonstrate in order to be recognized by the ABDS. So if cosmetic dentistry wants to be recognized, if their certifying board wants to be recognized by the ABDS, like anybody else, they need to submit the application with tons of documentation to demonstrate that they are in fact certifying dentists who have established, high-level competency, psychometrically based testing, et cetera, et cetera. So any entity, any certifying board can apply for recognition by the ABDS. And the criteria are available online, and they're very objective, and they're highly thought out. And actually, I think they're more transparent and more rigorous than many of the ADA specialty certifying boards.
And I can actually appreciate that transparency because, as you know, between department to department, if you get your periodontal or oral surgery specialty in one state and then you get it in a different state, you're going to have two different doctors trained at different levels. And so, some are
Exactly.
Some are 4-year oral surgeon programs, some are 6-year, some do a lot of blown grafts, and some do none, some do a lot of implants, some do more pathology. So they're not all equal, and I guess that's what this is trying to do, is equal that out. And I guess what you're saying is the American Board of Dental Specialties isn't going to say, okay, there's one group here. It's the AAID. They're saying there could be multiple implant groups that can deem you specialty, but the AAID has already gone through that process.
The AAID certifying board has gone through the process, been accepted and recognized by the ABDS. Of course, they're one of the founding members, but that doesn't stop any other implant certifying board for applying for recognition. You're absolutely correct.
Okay. So it's not like there's this one group, and because they've established dominance, then that's the only shot. So if the ICOI wanted to apply with the ABDS, they could do so and become a credentialing member as well.
Exactly.
Okay.
They want to take the politics out of it. They want objective criteria, and obviously it's not a trade association controlled entity. So I think the ADA is essentially winking to the ABDS and saying, we're glad you're here, because it's not going to be, we can't be accused of antitrust implications, and we can't be attacked for being a private trade association which is determining this.
What they're trying to do is make it more transparent, make it more open, set the standards equal. Because what you don't want is one group saying, okay, we have total control, you have to come through our system, and then they get to dictate everything. Because I guess my next question is, if a dentist was graduating dental school and says, well, I want to place a lot of implants, I should go to oral surgery school, why would someone go through a 6-year oral surgery program right now if they can do a 1-year GPR and then become a fellow with the AAID and market themselves as an implant specialist? Why would someone want to go to oral surgery school anymore unless they wanted to work in a hospital setting?
Well, I agree. I mean, if I were in that market, if I were a young dentist coming out, and I learned after being in practice that I really wanted to focus on implants, you're absolutely right. You're absolutely right. Focus on obtaining the credential which will deem you a specialist in implant dentistry. Now, interestingly enough, you raised another point. 3 of the 4 entities involved with the ABDS have CODA-approved postgraduate programs in their respective areas: oral medicine, oral facial pain, and anesthesia. Implant dentistry has many programs, postgraduate programs, affiliated with accredited dental schools around the country, but they have not been CODA-approved. So the AAID is in the process of applying to CODA for developing educational standards for the discipline of implant dentistry, which I think is very laudable.
Yeah, because myself, I went through dental school, graduated, started a full-time job, and realized I want to place implants, so took it upon myself to get training, knew that I didn't want to spend 6 years in an oral surgery program and wanted to tailor my practice towards implant dentistry. So by that means, I could skip the 6 years, start working, go to a maxi course over 1 year, and pass the test and be an implant specialist, while my counterpart was just starting his 2nd year out of a 6-year program in oral surgery. Now, of course, they come out and they might be an MD and OOMS, but I get a 5-year head jump on him being an implant specialist in my practice, and I'm making money as opposed to being in oral surgery residency.
And Phil, you may be much more proficient or competent in placing implants than they would be coming out of the program.
Yeah, absolutely.
They only have X number of hours to develop the one procedure like implants. Meantime, they've got to go through training for general anesthesia, for major jaw surgeries, all kinds of things that you don't have to deal with.
Yeah. So are we going to see a specialty for develop for fillings? Could I become a specialist in composite fillings?
A great question. I'm not aware of a certifying board that does that at this time, but it's hypothetically possible.
So I could potentially start the first one and become the first specialist in America at doing occlusal or posterior composite fillings if I got recognized between the American Board of Dental Specialties?
If there were a certifying board for posterior composites and it could pass the criteria for eligibility to submit an application to the ABDS, it's theoretically possible, yes. But again, the criteria are tough, and any board that's developed today wouldn't even qualify for X number of years to apply. They have to have a track record. They have to have X number of years of certifying, have to have X number of years to be able to produce psychometric validation, psychometric analysis, that kind of stuff. But yeah, so I could foresee, especially in forensic dentistry, not that that's something the public would benefit, but there could very well be a specialty certifying board, and there is in forensic dentistry, cosmetic dentistry, special needs dentistry, geriatric dentistry. These are all potential possibilities, and under the current structure of the ADA, none of them would be eligible to even apply, much less be recognized.
And I was partially joking there, but also partially serious, of course. So, but I'm pointing out the fact that implants is just one procedure, and we're talking about a specialty. So now, are we going to have a specialty for each procedure? And when does the general dentist decide? Because all of a sudden I'm thinking the American Academy of General Dentistry, the AGD, it becomes non-existent. Why would you want to become a fellow in the Academy of General Dentistry? Then you're just a you're a specialist at nothing, basically.
Phil, that's a great question. So what's to preclude the American Board of General Dentistry as being recognized as a certifying board in family dentistry or general dentistry, specialists in general dentistry, specialists in comprehensive dentistry?
Sure, and I think that's a great point, but I think it's now you're a specialist of general dentistry, and the term general dentistry itself denotes you're not a specialist. So,
well, specialist in family medicine.
Sure. But is that a specialty, I guess?
It is a specialty, recognized by the ABMS, the American Board of Medical Specialties, which is what the ABDS wants to emulate, an independent entity recognizing specialty boards. And if you look at the ABMS, they recognize family medicine as a specialty, and then then that specialty, the Family Medicine Board, they create subspecialties under the umbrella of family medicine.
Sure.
So I think currently the specialty of family medicine, that board is recognized by the ABMS. I think they have like at least 10 subspecialties in family medicine. So you could be a specialist in general dentistry and theoretically have a subspecialty in posterior composites.
Oh my. The possibilities are getting endless here, Frank, aren't they?
Well, Phil, I think ultimately it benefits the profession and the public.
Oh, sure. No, I'm just thinking, somewhat laterally, just to give an idea of where the scope is. So back to more, I guess, a little more realistic talk, though. So if I become a specialist recognized by the AAID and I become a fellow and I'm an implant specialist and my state recognizes it, the difference right now is if you're a specialist and you take insurance, the insurance reimburses you on a specialty level. Is the Delta Dentals and the Blue Cross Blue Shields then going to start reimbursing me at a specialty level?
It's a great question, Phil. I mean, I'd have to, if an oral surgeon is compensated for a root form implant more than a general dentist, then I would think if you're a specialist in that area and the ADA accepts you as a specialist, what Resolution 65 does, I would think the insurance companies would have to pay you on the same level as they do a periodontist or oral surgeon, assuming it's a different level.
Now, are they paying me, if I'm a specialist in implant dentistry, and are they paying me specialty fees on all specialty procedures or just specialty fees on implants? And let's say I do a root canal, which I'm not a specialist at because I'm a general dentist. Am I reimbursed at a general dentist rate, or I'm reimbursed at the special endodontist rate? Because those are two different fees if you're a participating provider with dental insurances.
I think you'd be compensated on the specialist rate for implant procedures. Just because an endodontist did it, I don't think that's implying the endodontist is a specialist in implants, which is not the case.
And then does that pertain to the implant placement and surgical aspects only, or the implant and the implant prosthetics of the fixtures on top?
Now, it's a great question, but it's over my head.
So, and I'm just thinking down the line. Let's say Kansas recognizes it. I become a fellow with the AAID. I place an implant. Delta Dental says, great, we'll reimburse you an implant fee. I go to place the implant crown. They say, nope, you're a general dentist. I mean, there's so many blurred lines now that have become created because of this. And does the AAID have the power and the leverage to go up against Delta Dental and say, you will pay them at a specialist fee? And I don't know if that's ever their job to do that, but I know specialists that doing special procedures get reimbursed at such. So what is the benefit for me, to take the 5 years and the $50,000 worth to get that training if my reimbursement is still at a PPO provider level?
I don't think it would be. I mean, the simple concepts of equity would ensure, in my opinion, that they would have to pay you on a specialty level for that service because you were, in fact, a bona fide specialist. Now, I want to clarify one thing. You keep referring to a fellow in the AAID. A fellow in the AAID is eligible to take the certifying exam from the certifying board, but a fellow does not constitute specialty status in and of itself.
Okay, my misunderstanding. So maybe that brings me to a great question. How does one become, let's say this passed in Texas, and someone wanted to become a specialist in implants in Texas now, how would one obtain that through the AAID? And can you walk me through the credentialing process in a brief, kind of easy to understand process?
Sure. First of all, when a court knocks down a regulation, right now in Texas, the four certifying organizations, those members can say specialists in implant dentistry, specialists in anesthesia. They can do that because they sued, they won. Now, the bad news with winning is that there's no criteria. So right now in Texas, theoretically, anybody could advertise as a specialist in anything. And we don't think that's a solution. It opens the door for everything to go down the line as a specialist. So what we hope in the future is that Texas adopts a regulation, a modified regulation that says ADA can advertise as specialist, those recognized as ABDS can advertise as specialist. That's where ultimately we think that's best for the public. We think it's good for the public to have some indicia of education, testing, et cetera, and experience before somebody can say specialist.
Well, who's going to have to enforce that, I guess? Because right now, if I'm a general dentist in Texas, can I say I'm an implant specialist as of today?
Yes. Unfortunately, that's probably true.
Yeah. So how's that going to get forced in then?
Well, the Texas board would have to amend their regulation.
Okay.
Because right now the regulation has been deemed unconstitutional, and there's an injunction against its enforcement.
So who's going to push for that then? Is there a major push for that, or what if the general dentist in the state lobby and say, no, we just like it to be what it is so that we can say what we want?
Well, I don't think the general dentist really would do that or want to do that. The push will come from, look at Resolution 65. It's a green light to the states to accept the ABDS, and the ADA is saying, we'll recognize them as specialists. So it's changed the Code of Ethics to allow so that the ADA can do. In fact, it says that the Code of Ethics now say that if your jurisdiction recognizes you as a specialist, we accept that. And the only breathing existing alternative right now to the ADA is the ABDS. And I have given presentations at the invitation of the ADA. I presented to the State Association Legal Counsel. I presented to the American Board of Perio. I presented to the Dental Specialty Group, which is an entity representing all 9 specialties of the ADA. I presented to a couple of state boards. So people are getting on board after they understand what it is, how it works, and the fact that it isn't just some self-declared certifying entity. It's been well thought out, it's well structured, and I think states can be very comfortable adopting it. And more importantly, I think the ADA is sending a clear message through its recent Resolution 65 that it's okay, we've looked at it, it's okay, we'll give deference to your state and your determination of specialties. And I think that's a wonderful proactive move the ADA House of Delegates passed.
Good. Well, let me turn this back. I'm gonna think kind of selfishly here because it's tough for me to put myself in other shoes at times. I'm a general dentist in Kansas. I place a lot of implants. I love placing implants. I would love to become a implant specialist in the state of Kansas one day when that happens. As of right now, I am a member of the AAID, and that's it. I've gone to some of the meetings, but I have not obtained any credentialing thus far. That is in my most urgent to-do category within the next coming years. Walk someone like me through that process. What steps should I take, in which order, and which one makes the most sense? Okay, I'm a general dentist. I have experience placing implants. I would like to work my way through the associate fellow, the fellow, and then what comes after that? You said the diplomat?
Correct. Now, it doesn't have to be in that sequence.
Okay.
Phil.
Yeah.
So if you went online and looked at the eligibility requirements for applying to take the Diplomat exam with the ABOI, you would look at that and say, okay, well, you're immediately eligible if you're a specialist in perio, oral surgery, pros. You can apply to take the exam.
And which exam is that?
The Diplomat of the American Board of Oral Implantology,
Okay.
the specialty board, the certifying board sponsored by the AAID.
Okay.
So you wouldn't be eligible in those pathways. You would look at the general dentist pathway, which has X number of hours of CE and implant focused courses, X number of years experience, X number of cases that you can demonstrate, completion, and then all the testing, which was required, the written and the oral examination. But the eligibility requirements for a general dentist aren't a piece of cake. And if you meet them, you've been doing implants for quite some time, and you can produce records to substantiate that.
Okay, so how do I? So let's just break down the associate fellow real quick. Associate fellow, there's a written boards that you have to take that at a various location. And
right.
there's an oral case that you have to present in front of a certain location.
Right.
There are various requirements for showing proof of restoring cases. Are those just photos and x-rays?
Phil, off the top of my head, I'm not sure. I don't know the details of each one. I do know that you, with a certain amount of experience and expertise that you can demonstrate, you could potentially just go right to the ABOI Diplomat exam. But most dentists take the associate fellow, maybe through a MAXA course, get that, and then walk up the ladder.
Sure. Now you're not saying you have to take the MAXI course, are you? What if I take other courses that aren't necessarily sponsored by the AAID? I mean, see what I'm getting at here? Do I have to take your courses through that program, or maybe I've taken 300 hours elsewhere?
That's right.
Now, how do I prove I've taken those hours?
Well, we all, for license renewal, we have to keep proof of our course attendance.
Sure.
You usually PACE or CERP approved. It's the same thing.
Okay. So we show 300 hours. We take the written. If we want to jump, let's say we get the associate fellow. Now let's say someone's been practicing 10 years. They have all the requirements, and they want to go right to the fellow. Okay. Do they still have to take the written test for the associate fellow?
I don't believe so. I think I would say take a look at the Diplomat. You might be able to go right to that.
I don't think I'm to that level yet, but I'm just playing slightly talking for other people here. If I felt comfortable to go right to the fellow, I could do that. Or if I had enough cases, had enough knowledge, and could present, I could go straight to Diplomat also.
Enough years of experience, whatever that requirement is, correct. Yes, you could.
That 55-year-old out there that was placing implants before I was born, he can jump right to the Diplomat if he has the experience and the knowledge base and the case presentations.
Right.
Okay. Great. So,
and I think that's a benefit to the public to be able to point to a credential, and the public can access and see what the requirements are, and have some assurance that this is real, this is bona fide, this isn't made up.
Sure. No, and I definitely agree with that. I think these are great. I'm just trying to put the flow and the pathways together so I can understand it. And put it out there so other people can understand as well. So just because I'm a fellow in the AAID, like you said, doesn't necessitate that you're a specialist yet.
Correct.
Okay. Only the Diplomat stage is.
Only the Diplomat is recognized by the ABDS. Right. You raise a good point. Okay, what's that mean to the state of Kansas? Well, the AAID realizes it now must educate state boards, communicate with state boards to get them up to speed on what the ABDS is and get them to modify their regulations to accept that. It doesn't just happen automatically because we're in a suit in Texas. We have to work with the state boards and get them on board, get them educationally informed as to what the ABDS is, and of course Resolution 65 will help in enlightening that particular board.
Sure. Well, if you know anybody at the testing committee, if you tell them to give me the easy test, I'll go ahead and pass. I'll go ahead and pass. I'm not the smartest tool in the box, but I'll take the easy test, become my associate fellow, prove my fellowship, and I'll start pushing here in the state of Kansas. If you guys need more people pushing, I'll just try to slip that by somebody there at the AAID. But so it's going to have to take each state to make that push and accreditation through the ABDS.
Yes, and again, I think that was a clear message sent by the ADA in Resolution 65, telling them, if you want to recognize this area of specialty and it fulfills your requirements, whatever it may be, we're fine with that.
Now, obviously, it being election time, I always equate this to, do you see this happening in more red states or blue states, I guess? I mean, where do you see states doing this? I mean, do you see states like Colorado and California that are more take things kind of first, pass? They were the first in the United States to pass the marijuana. Are they going to be the first ones to pass this in their states as well because they're more liberal? Or do you see Texas, obviously more a conservative state at times, they're the ones kind of breaking through the ice on this? Which state boards do you see doing this? Or is this an access to care issue? Is this states that have least amount of dentists available are going to push for this first? Or is this the areas where it's more populated? I mean, where do you see this being the strongest problem? Or states like New York where it's obviously highly dense in some areas? Who's adopting this first?
Well, interestingly enough, I think Ohio may be the first. It's in the process of now looking at the regulation. I've been up there. They totally understand the ABDS. I think a lot of the board members are saying this is the new reality, and I think we should accept ABDS. So I think they could be one of the first.
Now, is that because they're a swing state? Is that why everything has to go through Ohio first? Is that?
No, it's just that I think that politically they're less tepid about cutting a new path. And as someone who is licensed in Ohio, my career is started in Ohio. I practiced in Ohio, a former Ohio board member, and they've given me great access to present to them the whole history of the First Amendment evolution, the ADA specialty process, and the ABDS. They're in tune to what's going on. I've also presented the Kentucky board. They were very receptive, and I would expect and hope that in the near future they would do the same and amend their regulation. So I think once you get a critical mass, it's like dominoes. They realize that the state's not going to implode by doing this. The ADA has winked and said it's okay. I think it's been a matter of a relatively short period of time, considering we've been doing it this way since 1950, the ADA way. I think it'll happen. It'll just be a evolutionary thing, and the states will say, okay, Ohio has survived. There hasn't been a insurrection of dentists or patients, so let's go ahead and do it. And it also, I should mention, it gets them off the legal target list, because any state that only defers to the ADA right now is on our target list. So we're trying to communicate with them and get them to talk and understand this and take some voluntary action so we don't have to shoot another arrow at another state. Sure.
No one wants to be the bullseye in the middle of the block there. So,
Amen.
Yeah. No, I guess, you've covered a lot of information. I'll ask, maybe one more question about some things, and then you can tell me what I've missed. I'm sure there's a lot of great questions I can't think of. I'm just kind of thinking as things relate to me personally in my experience. But so let's say somebody says, I'm a dentist in any town, USA, and I love doing cosmetics. What should I go do? Or I'm dentist Anytown, USA, and I just love placing implants. What should I go do? Because I may have a year or two before this affects me, but I know this is coming. The tidal wave's coming in. It's on the doorstep. I can see down the road there's going to be subspecialties. I want to keep doing these procedures. I want to get better. I want to become accredited. What do I need to do?
Well, it's a very intelligent, common sense question. I would look at the most prominent entity in that field, and I I believe for cosmetic, it would be the American Academy of Cosmetic Dentistry. Look at what they require for their accreditation/certification process and target yourself for those courses, those requirements, etc. So when the day comes that if the AACD applies for recognition of a certifying board that it sponsors and it becomes recognized by the ABDS, you might be real close to being able to say you're a specialist recognized by the ABDS.
Great. And the same thing with implants. I guess the same thing with posterior composites. Whatever.
Correct.
Whatever it is you love to do, start figuring out a way to get that accreditation process. And if not, I'm going to start an educational center for posterior composites, and I'm going to lead the charge. I want to be the first specialist at being boring. I want to be the first.
Hey, go for it.
Yeah.
I mean, because ultimately, the more dentists who are seeking more education in whatever area is going to benefit them and the public.
Sure. So, what questions have you fielded in the past week or two that you feel are pertinent that people should know that I'm maybe not smart enough to ask, since I'm just...
Phil, I don't think you've missed anything, to be honest with you.
Because my understanding of legal terminology is pretty minimal, but I'm just trying to think as it relates to my profession and my career. I'm fairly young in this. I'm 35. I've been out 7 years. I love placing implants. I was in the process of looking at the credentialing anyway. This just kind of puts it on my radar and says, okay, this isn't a when I get get to it kind of thing. I need to look at, okay, this has to happen in 2017, 2018 because I want to be where the action is on the front line because that's just how I am. If I want to do something, I want to be the best at it.
And Phil, it's interesting you say that because if you woke up one day and across the street from you was a dental office and it said, John Jones, specialist in implant dentistry, you would want, from a marketplace standpoint, you'd want to get that credential so you could appear at least to be equal in skill, intelligence, and experience as the person saying specialist in implant dentistry. So you'd get up and you'd focus on that credential and you'd probably get it. So now we have two dentists who are well educated, well experienced, well trained, tested. Who benefits? The public benefits, and ultimately you stay on the same competitive level as the guy across the street.
Yeah, and that's all this is the push to better the skills and better the profession and make it better for the patient. And I get that. I'm just trying to look at as things sit right now. There's going to start to be what I don't want to see is this turns into a power struggle. This turns into a political struggle. Obviously with reimbursements and the DMSO growth and different groups and things splitting off and fighting between different organizations. I don't want to see this thing internally tear itself and tear the profession apart. I would love to see it unite the profession and put it in a better space. So I guess that's my thought is I love dentistry, I love implants, I love the AID. I want to see this make everybody better. I don't want to see it cannibalize the good things that are going on in dentistry. So that's my hope and concern with this is that it does make things better.
Well, Phil, right now, what you just said you feared, right now that's going on. I've deposed many people in many forums. And the oral surgeons believe they have the right to advertise as implant specialists. The periodontists believe the same thing. The prosthodontists believe the same thing. So we have vigorous competitive marketplace competition and infighting between several recognized specialty groups right now.
Absolutely.
And you and I both know as general dentists that somebody saying a specialist in implants simply because they're a periodontist and oral surgeon could be inherently misleading if we really delved into the experience they had. So in a way right now, the marketplace competition from an advertising standpoint is a bit misleading and is not entirely justified, but that's what's happening.
Sure. No, I agree. And that's going on in the dental schools. That's going on in specialties. There is a lot of infighting, and so hopefully this can solve some of that and put things in a better spot. And I guess that's the hope is that this will bring better things to come for all parties.
Absolutely.
Yeah, great. Frank, I I really appreciate you taking my call on short notice. I may call you back here in a couple months after another state falls or another legislative issue drops. But, I think this will help clarify things. I hope it helps set some parameters for people as to what to expect. And, like I said, if you've got any pull there at the AAID, just put a good word in for me when they see some little wide-eyed guy that's rough around the edges.
Consider it done, Phil.
Yeah,
consider it done.
I'm not the smartest tool in the box, but by golly, I try hard. So I'm going to be out there pushing as hard as I can to get that going and get some more activity here in the Midwest. And so I'll be checking in with you guys as things develop here. Okay.
Great deal. I appreciate your interest, and I appreciate the scope of your questioning. It was very informed.
Well, thank you so much, Frank. You have a great day, and I'll follow up with you again one day.
Thanks, Phil.